Do you have back or neck pain and wondering if you need an MRI?
Well, hold up. Most people don't. The research shows that MRIs are unnecessary and may lead you down the wrong path. And we both know of patients who've had this happen.
So today we're going to go over some tips to see if you actually need an MRI or possibly not.
There you go.
Bob and Brad, the two most famous physical therapists on the internet.
I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, Mike.
And if you're new to our channel, like this video, please subscribe.
Did anybody ever call you Michael?
Yes, my parents.
Okay, I guess we'll stop right there then.
Yeah.
Okay, let's get on with MRIs and seriousness of them. Should we have one or should we not?
So research shows up to 90% of people with no back pain at all actually have some type of symptoms when you look at their MRI results, whether that is something like degenerative disc disease, herniated disc, things like that.
Now, you may ask, why would they do MRIs of people with no symptoms? And it's actually, they've done it on purpose. They get people without symptoms MRI to find out how many diagnoses actually appear on the MRI without any problems presented by the patient.
So what really matters is how are you feeling? If you are having some pain or you are not functioning properly, maybe you can't walk anymore or everything hurts, you cannot sleep and has been very persistent, then an MRI may be important. But we're going to go over more specific list here in a second.
And keep in mind, we're talking about orthopedic like back problems and spine where we typically get symptoms of sciatica or pain running down the arm.
Yeah, so we are talking about anywhere from the neck, mid-back, all the way down because that's all your spine.
There you go. All right. So what's the next part?
When an MRI is actually appropriate to get. So the first big thing is when you have numbness, weakness, and tingling radiating down either your arm or your leg, and it is persistent and not improving over time.
And oftentimes, even if you have those, a lot of doctors will send you to physical therapy first and see if they can be reduced or fixed from therapy, which we have been successful with a number of patients on. So that is possible when you have those symptoms.
Another big issue is loss of bowel or bladder control kind of unexpectedly. This can be caused by cauda equina syndrome, which is a pretty big emergency situation. So you want to get that checked out right away.
Right. That is one instance where you don't mess around. You call your doctor, tell them what's going on, and the doctor will probably say, you need to go to the ER and get this squared away right away. I had one patient who had that. She went in, they assessed her, and it was not in a medical emergency, luckily, but it could have been. It's really serious if it is.
Obviously, if you've had some type of major fall or accident and you suspect you possibly have a fracture, that would be a benefit as well. Obviously, fractures show up on x-rays too, so you would know with a less expensive imaging exam.
Right. Yeah, we should mention MRIs are really good for soft tissue. They can get into some detail, but again, it can be misinterpreted by the radiologist or the physician. So they're not gold standard and give you the exact diagnosis. There is interpretation.
The last thing is if you suspect you have some lingering pain and it won't get better with any other options, you could have something like a tumor or possibly cancer developing around your spine. So obviously that's very important and will show up on an MRI more. You know, I don't know how you're going to know you have that unless you have an MRI.
Yeah, I know. I've always wondered about that too. And that is a pretty good argument to have one. And I don't know what the status is on that. We didn't get research for that. So I want to tell us a brief story about a high school girl had MRI on her shoulder. It showed rotator cuff tear. They decided do surgery, common surgery. But the problem was they went in. When they were in surgery, the MRI was not read properly. There was not a tear. Where was the pain coming from? So it's just an example that MRIs can be misread. And in this case, you know, the person should have had therapy and thorough therapy prior, because that's what happened afterwards anyways. So if you don't agree with your doctor and the surgery or the MRI is ordered and you don't want to do it, you can always go to another doctor and get a second opinion. That's can be a real good idea.
I should say that I've worked with some patients that have had spinal surgery as well, and some of them got better and some of them did not. So just because I had an MRI and it showed the issues and it did surgery, it didn't actually improve. So just keep that in mind.
Well, I'd like to finish up with Bob is in the back. He's listening and concurring. He's had similar issues in the clinic with patients themselves. Not that MRIs are bad. They're really good, but they're not. You just have to understand what their limits can be.
Now, some people, if you didn't have any of the red flags we talked about earlier, but you're still experiencing some pain, what are some things you can do? The first thing is to actually stay active and just do what you can. Obviously, if you're having a lot of neck or back pain, you can't necessarily do everything you want, but still do active and find activities you can do or just do them less intense, obviously depending upon your fitness level.
Good example, if you have an activity like sitting, driving long distances, and that gives you back and leg pain, you need to stop driving or change the chair, put a lumbar support in, put a pillow in, do something. But if you need to have if you do an activity that makes pain going down the leg or the arm, that's a red flag. You need to stop that activity.
Yes, you want to give your body some time to heal, but yet be active like we talked about. You can also obviously try physical therapy. I mean, sometimes we help.
We're proponents of that, absolutely.
And pain doesn't always mean you have damage. Sometimes whatever your injury is, it can heal. So if you notice you still have pain, but it's improving each day or each week, then I would definitely hold off. You don't need an MRI right away.
All right. Shall we continue on, or have we put out the information in its fullest and adequately?
I think we put it out adequately, but if you're still experiencing some back pain, you can click on the video link on the screen.
That was a nice segue. 6 best low back stretches for MAX, max pain relief.
Thank you for spelling out Max.
Every position.
Thanks for watching. Bye.
It is a nice video, very comprehensive.
Bob and Brad, the two most famous physical therapists on the internet.